Hi, Paul. Hi, Leslie. How are you?
Hello?
Hi, Mary. This is Dr. Fine. Welcome, Arnold. Thanks for meeting me today.
When it comes to virtual care, InterSystems gives healthcare providers a complete picture of their patients' health through data they can trust and seamless interoperability.
I'm reaching out because your smartwatch alerted us of a possible irregular heartbeat.
I see she's allergic to amoxicillin.
It says here you started taking sertraline last week?
By providing clean data when providers need it most, InterSystems enables them to make faster, smarter decisions, resulting in the best possible care for their patients.
It doesn't sound serious, but I would like to run a few tests just to be sure.
I'll send this medication to your pharmacy, and she should be feeling better in no time.
I'm glad you're here to begin counseling.
All right, I want to give it a try.
Let's get started.
As the power behind over 1 billion patient records, InterSystems brings together doctors and patients, no matter where they are. InterSystems, the power behind critical data.
Hello and welcome to this webinar on Future Gazing Healthcare in 2021 and beyond. My name is Elizabeth Suka. I'm Managing Editor and Global Healthcare Editorial Lead at the Economist Intelligence Unit. Before the COVID-19 pandemic, many clinician visits with patients were undertaken face-to-face, but the pandemic sent entire communities into lockdown, meaning healthcare systems had to quickly adapt to digital and telehealth approaches, like remote care and virtual monitoring of patients, without knowing whether these would be effective or feasible. It seems today's plugged-in society is more primed than ever before for this shift in care, where the home has become the hospital, or where we transition to a model of healthcare at any address. And all this transition has been driven by data and technologies. And while we've had a taste of this digital transformation during these turbulent times, how much of it will stick? What are the challenges and benefits? And what will the future healthcare landscape look like for you and me? I'm really happy to welcome our expert panel today, where we hope to discuss this and more. Today we have Mobasher Bhatt. He's the Chief Medical Officer at Babylon, an organization known for its digital primary care doctor service and for an app it has developed for the National Health Service, which uses AI. Also, we welcome Prat Vimana. He is the Chief Digital Officer at Kaiser Permanente, a US healthcare provider which serves over 12 million people in 39 hospitals. And also we welcome Kristen Fissery, who leads Accenture's North America health practice as a managing director. The practice advises health systems, physician bodies, and payers. And finally, Don Woodlock, welcome, Vice President of Healthcare Solutions at InterSystems. Don oversees a number of software platforms which are used for healthcare providers around the world. And we extend a big thank you to InterSystems for sponsoring this webinar. Fantastic. Welcome.
Thank you.
Let's start with top thoughts on what the healthcare experience will look like this year, in 5 and 10 years' time. Kristen, would you like to start us?
I would. Thanks, Liz. As I think about healthcare looking forward and the experience that we're the new future really of healthcare, I see a really profound change, one in which we're pivoting from customers coming to healthcare going to customers. And in many ways, I'm excited about that because it reminds me of the healthcare I experienced growing up that was really effective. I actually spent many of my summers working in the clinic that my grandfather built off the side of his house in Natrona Heights, Pennsylvania. He built that clinic because he wanted to be close to the community that he served. The hospital that he was on staff was 12 miles down the road, and that was very difficult for patients in that small town to get to in many cases. And so I saw how he was there present for and taking healthcare to his customers. And in fact, he actually did house calls. And so on any given night, he was out delivering a baby or checking on a patient that had chest pains. And so his community really appreciated the way in which he really brought healthcare to them and made the experience much more effective. we have an opportunity, I think, now to make house calls a reality. You talked about taking it to the home. And I see that manifesting itself in two ways. One is technology. We all have seen overnight how we've adopted the use of virtual visits. And the good news is patients and providers really like it. In fact, we've recently surveyed patients that said 60+% of them expect technology and that experience to persist. And they really think that healthcare, at the experience they received as a result, was on par or better than what it was before COVID. And then the second way I see it manifesting itself is with very innovative companies leveraging their assets, physical assets, to innovate and bring healthcare to the home. One example is what Best Buy is doing with Geek Squad. Geek Squad has 20,000 agents around the world. Many of them are in the United States. And those agents that used to come to our home to fix our computer or our printer are now standing up medical equipment and helping people in their home with the monitoring that they need for their care. So I'm really excited about the opportunity to marry the technology and the physical assets to make house calls really a reality again.
Thank you, Kristen. That's really interesting. And Pratt, what's your take on this and your future? How do you see it?
Kristen really summarized it really well, right? So the biggest opportunity we have in this 1 year is this momentum COVID has created, right? Ability to bring telehealth, to a convenience level that everybody can access care anywhere, anytime. But the 5-year journey Christian is alluding to is actually pretty, impactful in the sense that we can go way beyond just at the time of need to preventative and overall health and wellness. And I think digital can really pave a way to do that. And I think that's an exciting part that we have to all dream about and also start to build towards.
Fantastic. Don, can you tell us what your thoughts are on this in the future?
Sure. I certainly like this concept of bringing care to the person. And I think the future with digital tools will be more patient-centric and more physician-centric, really. And by patient-centric, I don't mean just kind of more friendly and convenient, but more about them. Like one of the projects that I really like in London actually is the NHS's Coordinate My Care project, where patients can work with their clinicians around their end-of-life care plans. They can document that, and then those care plans are available for anybody, the ambulance driver, the family members, the patient, the GPs, the caregivers. Everybody really knows how the patient wants to end their final days, and then that care becomes much more focused on them and really reflects their wishes. And so kind of digitizing and bringing information to everybody that needs to know it really enables the care to be more focused on them. And on the physician front, I think a lot of the tools around conversational user experience, interacting with the clinical data via chatbots, I think this also makes that experience more about them. So I do think that data can really empower the people involved in the care system to be both more convenient but more enjoyable and more impactful based on what they're trying to do.
Thank you, Don. I'm really glad you raised palliative care. It's not a topic that's often raised. And Mubasher, what are your thoughts then for the next year, 5 and 10 years?
Sure. Well, I think we only need to look at the past 1, 5 and 10 years to know that change in healthcare is, really coming on at a very fast-paced trajectory. And a lot of that change, has been enabled by rapidly improving technology, whether that's sophisticated diagnostic capabilities or the growing use of AI like we've used at Babylon. That said, I think it's clear that the future of healthcare is not about using technologies such as AI to replace doctors or clinical best practice. And in fact, I think the use of these kind of technologies is really about supercharging the work of physicians and augmenting best practice. And perhaps even more excitingly, I think this type of technology helps create a world in which, exceptional healthcare experience is not just for the wealthiest members of society. And as a doctor who's practiced in both private and public health systems, I've seen what exceptional healthcare looks like, and it is achievable, but you need a lot of resources, whether that be people or money, to achieve it. But with digital technologies like AI, I think we've got a really great opportunity to create an exceptional healthcare experience at a fraction of the cost, and without the need for so many doctors and nurses, which will hopefully help us achieve better outcomes for patients, no matter where they are on their healthcare journey. And look, ultimately, if we get this right in the next 1 or 5 or 10 years, healthcare should really become a much more seamless experience for patients, for providers, start closing out some of that fragmentation that we see today. And I think there's some really, some key areas where this kind of technology-enabled approach will really help. And I think the first one is, delivering integrated care with a really strong focus on outcomes. I think improving the management of chronic disease, so, using tools that empower patients to do that. And then thirdly, I think, increased capabilities for remote monitoring and remote consulting. And, a lot of that is going to be delivered through what we all carry in our pockets, the smartphone. And if you think just how far these devices have come, their capabilities in 10 years from now will no doubt be staggering, I'm sure.
Thank you for that, Mubasher. And you've raised a lot of points I want to discuss in this talk today. But back to you, Prat. Let's just look at other industries for a moment. So what other elements or best practices from other industries where they've, involved information, they've created a seamless consumer experience that the healthcare industry can learn from? I mean, what are your thoughts on this, Prat?
A great question. Coming from retail, leading digital for the last 10 years, other industries have certainly traveled in the digital space, especially this idea of convenience and consumer-centric experiences. This idea of access anywhere, anytime, right? Whether it's banking, whether it's travel, the ability to actually quickly access the information, get the convenience that you need, and also help get answers very quickly, right? So that you can borrow a lot from banking and travel. Insights driven by data, leveraging that to create experience. You look at retail. It's not about the 100 million products in the catalog. By typing in 3 words, they already know what products you need. I mean, that kind of intelligence is actually we are seeing in retail. And also, getting really digital assistance. If you really look at telcos of the world, has done quite a bit around chatbots and really taking care of the most frequently asked mundane questions out of the way, right? So I think there's lots we can learn from other industries coming into healthcare. If I turn that into, where healthcare is today, healthcare has, the 3 things that we look at, right? Healthcare mostly has been post-visit engagement from a digital perspective. I visited my physician, then I need to access my prescriptions and labs and, any notes from the visit and any follow-on. It's very heavily in the post-visit engagement. And also, Don touched on this idea of provider and workflow is what is actually driving the healthcare experience. We can flip it and say, what is, as a consumer, what is my experience going to be, and building around that. And also this idea of, engaging only at the time of need, whereas I think we can be there holistically all the time, right? So there's big shifts that we are seeing that other industries have done quite successfully that we can really borrow into the healthcare space.
Don, I don't know if you want to add anything on that, but also I'd like to ask you another question. Taking the experience of the pandemic, to what extent are policymakers and industry capitalizing on the shift in attitudes now with stakeholders to use digital services for the long-term transformation?
Well, I think the pandemic has really taught us how critical good, healthy data is, sort of take care of a community and quickly adapt your organization. I have lots of our health system customers say they would not have been able to respond so quickly if they didn't have that kind of consolidated EMR infrastructure. setting up new hospitals, rearranging floors, closing ICUs, turning into COVID, floors. All that stuff was done incredibly quickly because of that digital infrastructure. So I do think that, all of us have come to appreciate the investments we've made, over the last decade to really create that platform where we can be nimble and agile and respond so quickly to the pandemic. So I think that's really been a strong suit there. And I would agree with Pratt from other industries, leveraging data, to really drive change, to drive innovation, to learn and be more insightful about taking care of a community or a population. Other industries do that well, and healthcare is just trying to do that now. And having that accurate reporting on COVID, whether testing and now vaccines and case rates, and whether we're at the peak or the peak is coming, that's been very critical, of course, in managing this pandemic. And without data, it would be very difficult for us to have been, as successful as we've been managing this.
Thank you, Don. Kristen, to you, since we're kind of talking about the hospital sector now and secondary care, can you talk us through what parts of the care pathway, in your opinion, in hospitals and specialities are more aligned or more open to digitalization, in your opinion?
Well, I think obviously there's a lot of opportunity for bringing technology to support some of the changes around that care continuum. And I'm thinking about, we talked a little bit about chronic care management, and I'm thinking about the ways in which we have an opportunity to influence those the care of a chronic care patient. For example, we believe that a diabetes patient, there's 10 moments that matter. And those moments are, many of them outside of the purview of a clinician. And this is where the power of, I think we'll probably talk a little bit about cloud, but some of the digitization and the access to data is so important, because those moments that matter are going to pull from some of the retailers that are doing pharmacy data, that maybe from a grocer that is providing information about the diet of that patient, or maybe it's something like their exercise equipment that's telling you information about how much they're exercising. And the ability, I think, to bring technology together and connect all of those is so important, and is going to enable us to have a much more holistic picture of the patient, and Pratt talked about that, and then actually really influence care more proactively going forward.
Thank you for that, Kristen. Really interesting. And Pratt, back to you. Because you're involved with so many hospitals, can you talk us through, in the digital transformation of your hospitals, what was the easy, low-hanging fruit, and what has proved harder in this?
So through COVID-19, we've been doing telehealth for a long time, right? And we had, like about 12 to 14% of our care was always delivered through telehealth. So we always had that success. But in COVID-19, we needed to shift to near 100%. So this idea of shifting to, almost like 90% of the, ambulatory care needed to be shifted. We almost shifted 100% of mental health to telehealth. I'm talking about between phones, emails, and video visits, over 50 million interactions that we delivered in 2020 alone, actually, right? So what that meant was, not only it's the consumer shifting to these new modalities, and being comfortable with it, but also providers shifting to these new modalities. For them to be able to actually get comfortable with the technologies, they're trained to feel the belly and touch the patient and see the vitals, right? So how do you do that, in the best possible setting in a telecare environment? So I think the biggest shift we saw was the mindset shift and adoption and acceleration of that fairly quickly. And the second thing is this self-care. as this COVID was unfolding, everybody was looking for information. How do I know I got it? How do I know I can prevent it? Being available through information and effective information, and a highly interactive AI experience, that at least gives you initial preliminary diagnostics that whether you have a high, low risk. Things of that nature had needed to be actually transformed as well. And in the hospital's physical setting, we needed to adopt very quickly. How do you triage, bringing thermal cameras, for example, as they walk in? How do you even protect the staff in the hospitals to make sure that they are protected as well? Because they are the frontline workers that we needed to protect. And so this has been, in quite a few ways, it has been impactful across the hospital and the delivery system.
Thank you for that. We'll come back to secondary care and hospitals. Let's jump back to primary care now, so we can ask Mubasher a few questions. So, Mubasher, in any future digital model of care, we'll need to consider the role of the gatekeeper to healthcare systems, which is your GP or family physician in the US. So in the UK, we've seen a lot of GPs turn to remote care, mainly the telephone during the COVID crisis. But what can you expect primary care to look like in the future? And also, will we have fewer family physicians on the high street? And will we lose that kind of local neighborhood care with this move now to kind of remote, care? Love to hear your thoughts on that.
Yeah, sure. Well, I think there definitely has been, a huge shift to remote care in the primary care setting, and I think the thing about that is, I think for some people that's been a great experience for the patient and for the provider. But I think that there is a word of caution, and I think it's really important to ensure that when you're delivering care in this way, it's really designed from the ground up. And so, if you think about the sort of things people have had to adopt in a primary care setting, they may not have a system that enables them to deliver this type of care. And so they've had to rely upon technologies a bit like, conference calls, Skype, Zoom, whatever that might be. Now, of course, that's great because it connects the doctor and the patient. But it's not an overall digital experience. So the booking of the appointment it could still be very clunky and cumbersome. There'll be no reminder to the patient on their phone that the appointment's about to start and they need to go into a quiet place with a good connection. There's no digital pathway for them to be able to then pick up their prescription once the doctor has issued it. And I think that's a big difference. What we've done in the primary care space is really design the whole end-to-end experience from the ground up and making it really patient-centered. And that really means, everything. You've got to focus on the user experience, the interface, the design, just kind of going back to what Don and Pratt were saying and Kristen, I think that drawing lessons from other industries, is going to be vital because, many of those have made great progress in thinking about that whole user experience. So I think if we go back to...
I was just going to ask you
go
about...
ahead.
So with Babylon, explain to our audience, what sort of patients do you mostly see? Are they young? Are they digitally savvy? Are they without chronic medical conditions? It'd be just interesting to see the patients Babylon sees, because if this is the future, it'd be interesting to see how it's currently looking at the moment.
Yeah, I think, when we launched Babylon 6 years ago, there's definitely a greater preponderance of kind of working age, perhaps more digitally savvy patients. But I think what we've seen, there's been a big mindset shift, in patients. And so I think our oldest patient is 94. So, people at that age, their carers or family members can assist them in using this type of technology. We've had good success in using patient participation groups to help those less familiar with technology become familiar with it. And so I think, in terms of the spectrum of issues, we see the full breadth of primary care. And for chronic disease management, it's excellent because the doctor can not only connect, to the patient in a very accessible way. But a lot of the digital tools that support the consultation, in between your consultations, are the results of those things are available to the doctor in the consultation. So, the doctor can track things like nutrition or activity levels and see those objectively in the consultation.
Thank you, Mubasher. I might ask Kristen to comment here. What do you see the future of our corner local GP surgery in 10 years' time? Are we going to have fewer numbers of, bricks and mortar sort of establishments? And is that a good or bad thing? Or do you see the future, Kristen?
So I agree with where the points Mubasher said. We actually did a study, it's almost 10 years old at this point, which was talking about the decline of the independent physician in America. And actually at the time it was driven primarily by economics and by the need, the push to get physicians onto EMRs. So the technology burden was heavy, and so many of them either retired or sought employment with health systems. I think that those physicians still play a critical role, and I wholeheartedly agree. We cannot let technology fully take the place of human interaction. That is so important going forward. We have to find a hybrid. And so I certainly hope we're not going to lose all of our physicians, but I think they're going to change. And I think that our patients are telling us, I want to be able to, in fact, I know they're saying they want to have a hybrid option. And in fact, we 2/3 of patients said they were willing to switch physicians if they didn't have some kind of virtual option, or if they had to be seen in a physical site, they wanted to make sure that that site made them feel safe and secure and that they were following safety protocols. And then the third thing, actually, that's very interesting is they wanted to make sure that their physician had up-to-date information on them and actually that it was secure as well. But so I think I see certainly it is declining. I don't have the latest data, but I suspect that trend is still continuing. But it's being the gap is being filled with the Kaiser Permanentes who have clinics across the country. It's being filled by other retailers like Walgreens and CVS and Walmart, who are putting together very innovative models to outreach to the community. But again, I want to make sure we're mindful. We can't let technology totally take over. We have to find that balance. And I'm seeing evidence that I think our healthcare community recognizes that balance is very important.
Thank you, Kristen. And as we know, healthcare systems and healthcare professionals very much rely on data, on evidence and effectiveness. So let's just talk a little bit about telemedicine and effectiveness. So as you were saying, Mubasher, if you're a doctor, you might have to manage a video platform. You've got to look at the electronic healthcare record. You might have an older patient and they may be frail. So what sort of research do we need to see if remote and digital-led care is efficient and effective compared to standard care? I mean, I'm just wanting to know, what's the landscape at the moment for the evidence? Maybe, Don, I don't know if you want to come in. Is it too early days? Or I'd like to hear your thoughts on the evidence base at the moment we have.
Well, I'm not sure we have much yet. The shift is relatively rapid. I do think that care in this model is certainly getting more longitudinal and more integrated. And if you rewind back to sort of the inpatient, hospital only experience, it sort of made its way to GPs, made its way to the home. Patients want to be healthy and they want their whole life cycle to be managed in cooperation with their care team. So I think the hybrid model, like Kristen was saying, is kind of a perfect model to think through. In terms of the evidence and care, differences in terms of outcomes, I haven't seen a lot of studies about that yet. We have worked with a number of life sciences companies that have been quite interested in how the effect of all this remote care has had on, their kind of visit experience, their adherence to medications, their attitude toward their disease. And, there are certainly risks especially during these pandemic days, that certain care areas like mental health and cardiology and chronic conditions have been under-managed. So hopefully we'll get back to a state of new normalcy and be able to model this so we have the same or better outcomes with this new hybrid model.
Thank you for that, Don. So, I mean, I've seen studies, showing telemedicine safe, patient-centered and efficient, especially during the pandemic, and some for rare diseases as well, which is really interesting. A lot of patients haven't seen their, rare disease specialists. They have been able to through telehealth, which is fantastic. So, reimbursement pathways for telemedicine has traditionally kind of been a barrier to implementation. And so I'd love to understand from everyone what needs to take place to adopt this into clinical pathways. Maybe Pratt, you can start us off on that. Thank you.
Absolutely, Elizabeth. Don, if I could add one thing, the two areas that I look at, right? One is, are these modalities effective for all the conditions? And, would we be able to say these type of modalities are better? If you have sinusitis, should it be video and in person only? Can it be actually a phone? Will it be effective on a phone? The biggest thing that we have done is that this 2020 has generated a lot of data for us in terms of, not only the conditions and symptoms, but which modalities are applied and how effective it is going to be. Even though we don't have data now, but I'm strongly believing that in the next 2-3 years, we're going to see incredible amount of data that's becoming available, research that's becoming available in this space on effectiveness of telemedicine, based on the conditions and modalities. We've also seen in the post-operative care, selective areas where digital is very impactful, right? So cardiac rehab, for example, we were able to actually fit the patients with smartwatches with a very specific, routines that they need to take and whatnot. Not only the adoption went up, the outcomes were outstanding, actually. So what we are seeing is this ability to actually, but much more targeted, applied at a programmatic level, right? So those two are good examples where we do see that this applied digital in the right way, I think will definitely be, there's a lot to come that will shape the industry in the days to come.
Okay, and I don't know, maybe Mubasher, you'd like to comment on the reimbursement pathways. I mean, how do they need to evolve? Because traditionally there's been a bit of a barrier for telehealth. What's your thoughts on this? And maybe Kristen as well.
Yeah, there certainly has been a bit of a barrier, and certainly in some countries, of course, telemedicine isn't reimbursed by payers. But of course, that's changing, and I think in countries like the UK and the US and others, of course, telemedicine is now reimbursed. I think our experience, certainly in the UK, working with the NHS, what we were able to show is actually, even in a capitation-based model where, doctors are paid to look after a population of patients on an annual basis, that actually, the wide-scale use of telemedicine has been really effective. And interestingly, what the data is showing is, if you use digital healthcare to improve accessibility and affordability in the primary care setting, we've seen some really impressive results in terms of downstream savings in secondary care costs, because people are not presenting to emergency departments or emergency walk-in centres. And so I think that type of data is really going to speak for itself, and I think really pave the way for better reimbursement of telemedicine. So hopefully, that changes in other parts of the world where it's not currently reimbursed.
Did you want to add anything, Chris?
Sure, I wholeheartedly agree. And the barriers temporarily here in the United States came down. We believe they need to endure. And they need to endure because our patients and our customers are counting on them to endure. Back to the points we were all talking about, the pandemic has truly shaken the confidence of our customer base to the core. Last summer at one point, I came across a study that said 80% of Americans were fearful of walking into a hospital. I mean, so we have to find some ways to bring healthcare again back to them and meet them where they feel safe, both physically and actually digitally. And I agree with what Pratt was saying about we have several clients that are looking at virtual is here to stay. We believe actually it'll probably settle in at around 35% of visits going forward, way up from less than 10 before the pandemic. And we have several clients, just as Kaiser Permanente is doing, looking at which services and which patients are ideal for a virtual visit, and how do you use analytics to identify that match and then set up the operating model, the staffing, et cetera, to support that encounter and that patient. And so I think we have an obligation as leaders to make sure that we can break through some of these reimbursement challenges, because otherwise we're going to have people not coming in for the care that they need, and that's going to create a lot of other challenges downstream.
Yes, that 80% statistic is quite stark. Great. Let's move the conversation now to the role of data and what data can do, because everything's going to be underpinned by data. So, Don, let's go back to you, Don. So how we use data, how we access it, will be driving change for the future. So in your opinion, how will data sharing technologies continue to evolve, and what will the future of healthcare data look like in 5-10 years?
Sure. Well, I think we made a lot of really good progress around bringing data together for the care of an individual patient. So really empowering a clinician to see that unified picture of the patient and make the right choices. And that's really critical. Patients have comorbidities. A lot of the information about your other problems are in other systems. So bringing that together and empowering the caregivers to see that whole picture is, perhaps phase one of what we've been working on, and I think we made a ton of progress on that front. I think the next phase is really around making data useful in aggregate for research, for AI, for population understanding, for collaboration with life sciences companies or those kinds of things. And I think data really isn't that clean yet and in a form that it can come together, and you really need to invest to make that happen. I'm a musician, and so whenever I go to somebody's house and they have a guitar, I like to kind of pick it up, and whenever I pick it up, the first thing I do is check whether it's in tune, and if it's not, I tune it. And the reason is, if you play guitar, there's really nothing you can do with an out-of-tune instrument. Even if you play well or have a great song, whatever, you got to tune it first. And I feel like our healthcare data, it's there, but it's kind of badly out of tune. And so kind of step one really is to aggregate it, normalize it, match patients, apply terminology, apply natural language processing, get it in a form where you really can, use machine learning on it or learn things from a research point of view. And I do think an upcoming phase really for all of us is making sense of that data and really leveraging it to drive care going forward.
Thank you, Don. And Kristen, back to you. There are some concerns by patients and others around data privacy and security. This topic comes up often. Is that the biggest trust barrier, and how can we resolve it so data can be used safely and sustainably for population health? Because there's so much information locked in that data. Love to hear your thoughts, and then we'll ask Pratt as well.
Yeah, absolutely. And Don, I agree with what you're saying about the untapped potential of the data that we sit on. On the security point, I actually want to pivot to the cloud as well and kind of roll these two all together, the point around disaggregated data. And so at Accenture, we actually believe that by 2025, 80% of our clients across industry are going to be in the cloud. Today, we sit at about a quarter of that. So we have a ways to go. But one of the key things, I'm encouraged by the movement in our healthcare industry, and actually security is one of the things that is driving the CIOs to put this as a top priority. And the reason being is we're all very acutely aware of security issues. It's in the news now in a very material way, and certainly we've been dealing with it in healthcare for several years, and the risks are great. But for a CIO, keeping up with those security threats is really a challenge, and the security is becoming more challenging, and access to talent and resources to mitigate against it. And actually, one of the things that they're citing as a reason to get to the cloud is the ability to mitigate some of that security, in addition to upgrading platforms and keeping up with all the demands for virtual that we've all been talking about. But I think what we have to realize is the potential of cloud and is really what's the next iteration, which is around harnessing this data in a way that you can connect the dots, just as Don was saying. We sit on this treasure chest of data, but it's in lots of different pockets. And as we start to move to the cloud, that data becomes much cleaner and much more aggregated in a way that we can do some of the AI that we're all talking about and keenly excited about, because that'll enable us to really manage health and wellness of patients. And then with the consent, we do have to make sure our customers and our patients feel that that data is secure. Because once they do, they will give us the consent to enable us to harness that data and really more proactively manage some of the care plans for them and mitigate risks. And we've been talking a lot about, the different types of data and where it sits. The high-tech folks are driving us to the cloud. Big companies are driving us to the cloud. We've got to catch up, because once we do that, we'll be able to stitch together the data that might come from my Peloton, about some of my vitals, or the data that comes from my, grocery store about the healthy foods I'm buying, and my clinician will be able to stitch that together in a much more holistic way. So I think it'll create a value proposition, but we absolutely need to make sure patients feel like their data that they're consenting us to use is secure.
Thank you for that, Kristen. And Prat, whatever you want to add on to what Kristen just said there, but also another question for you. Sometimes it's said that hospitals are very nervous about sharing their data. So what's your take on this and the role of the cloud and progress in this area?
Great points Kristen is making, right? Not only the privacy is important, but also, the confidence that the patient needs to have that, it is in the right hands. So when I look at the data, we can draw this from the other industries also, right? 20 years ago, if you want to invest in stock, you got to know a broker and they had the data and they had the insights. 20 years ago, if you want to buy a product, the retail had a lot of data, but the data was used for back-end operations, optimization. Today, hospital systems across the globe using data is around back-end effectiveness. Whether it's population management, whether it's hospital utilization and throughput, ability to have effective, plans on managing across the board, definitely around the payer space as well. Where the biggest shift we are going to see is that we have seen in the other industries, that if the data can be made available and made a real-time intelligence and made useful for the consumer, it really becomes, it really opens the discussion there, right? So my kids, with with an app, they're able to invest in a stock market because they know what the data, they have the power of the data right in their hands. And you're seeing that in the retail as well. So I think the healthcare shift is moving the data usage from back end. I think, it's important, but applying the data in the real time or near real time for patients or consumers to help manage their health, wellness, and their chronic condition is going to be where I think the floodgates are going to open. It's very important that we actually go there, because that gives the scale, number one. Number two, that also makes the consumer manage their lifestyle. Kristen talked about moving from provider-centric experience to consumer-centric experience. The experience then becomes holistic, actually. So these pivots will help ease the concerns that members have, but also they can see the usefulness of providing the data.
Thank you, Prat. And Mubasher, what sort of data does Babylon would really love to get its hands on that you feel that would help improve outcomes for patients? Because at the moment, can you easily get, say, the electronic health record for patients, that use the service privately? I mean, do you have to get permission, don't you, for GP services? Or can you explain it to us?
Yeah, sure. I think what a sort of a challenge that you're describing is interoperability between different health systems, and that's obviously a big challenge that many health systems globally face. And it is difficult, for one EMR to talk to another EMR. But I think there has been good progress there, and you can use other technologies such as things like robotic process automation to help transfer data safely from one area to another, even in the absence of a deeply integrated solution. So those are the kinds of things we've used to do that. And with certain patients, we may have access to their full medical record. Now, I think the interesting thing also is to think about this from the physician side of things as well, because in a standard consultation already, the physician is pretty overloaded with data. There's many things to look at during a consultation, and I think as we become much more sophisticated and we gather much more data, and we create a new kind of medical record, which will be, this very complex longitudinal record with data points which, never existed in healthcare, all available to the doctor at their fingertips. I think it's going to be imperative that we also train our physicians to be able to process that data in a sort of timely and meaningful way during the consultation. So I think it's great that we have all this data, and it's great that interoperability issues are improving, but we really need to think about how do we leverage the data, particularly at the point of care.
Thank you for that. And Don, back to you on this. As you work in many, many countries around the world, which are showing the most impressive healthcare digital and data transformation in your opinion? Putting you on the spot here.
Well, I have a fondness for non-US experiences. We've seen a lot of really great kind of regional oriented initiatives where you have kind of the Minister of Health for the Veneto region in Italy, or the Dubai region in UAE, or Lincolnshire in the UK, that have this responsibility and kind of clear ownership and accountability for the population and many of the hospitals and other facilities in that region. Maybe it's like the Kaiser model in kind of different parts of the world, where you really take responsibility for 1 million or 10 million patients in your region. So a lot of those kind of regional coordination efforts, I think, have been really terrific in terms of just understand, in the pandemic days, understanding what's going on, where are the hot spots, where do we need to pay attention, where do we need to add new beds or get ventilators or now get vaccines, that kind of thing. So where you have a level of information and bring together 1 million citizens or patients or members or that sort of thing, you can really kind of make decisions properly and use data properly. Another example we work with is the VA, and the VA integrates their records across their 130 kind of EMR instances right now into this data platform, and they've used that to coordinate kind of vaccine distribution. They have sort of argued successfully based on data how many vaccines they would need for their population, and that's been very effective. It's apolitical. It's sort of data based in terms of what's really needed to take care of that group of patients. So it's hard to pick favorites, but where I see that integration, where I see that kind of clear accountability for a group of patients and citizens and members, I think it really works well.
Well, thank you for that. Let's shift the conversation now to patient and inequity issues. So the digital divide needs to be acknowledged. Not all patients have, access to a smartphone, have suitable internet, or have the digital skills to use technology. So how can we support patients so the future is inclusive? I guess I'm really asking is, how can remote care retain the human touch and stay patient-centric? Mubasher, maybe you can start us, please.
Yeah, sure. I mean, I think, that this is a really important issue, and we've got to constantly be mindful not to create a digital divide. I think, we're all embracing the digital approach, and, we've seen during the pandemic the many benefits it can bring. But I think, certainly in our experience at Babylon, it's really about adapting the approach and the technology, tailoring it to populations or specific segments. As an example, our service is deployed in Rwanda in partnership with the government and the Bill and Melinda Gates Foundation, and there we had to redesign everything, to work on a basic feature phone and design the system so it complemented the existing healthcare infrastructure. So, and I think so. And the reason I'm referencing that is I think you can design digital services in a way that tries to mitigate against creating a digital divide, but it does take very purposeful design to do that. And I think, final point that, whilst it's very important for us to consider this concept, equally, I think, we should be careful that it's not used as a weapon to stop or slow down innovation.
Thank you for that. Kristen, do you have any comments about how do we keep that, keep remote care still having that remote touch? What am I saying? Human touch.
Yeah. I think certainly the pandemic has awakened all of us to our responsibility to our fellow man, and that society going forward, we recognize that healthcare is now everybody's business, not just our own families, but more broadly our responsibility to our communities. And I see a couple of key things happening. I see many of my clients talking about using kiosks or using the mobile buses, if you will, to get care to communities. I think about here, even in Georgia, where I live, we had buses that were going out into underserved communities with Wi-Fi's on those buses to enable kids to dial in to get be able to do virtual schooling. I can envision we'll see more of that happening in healthcare as we look to ways to get vaccines distributed and care into communities that are underserved. I think the other thing too, and we touched on it briefly, is just around mental well-being. That's an area that we're really focused on because I actually believe that probably is our next curve to flatten, unfortunately. And that's an area that is so underserved and is a huge issue in all of our communities. 1 in 5 Americans suffer from mental health, and less than 50% of them are getting the care that they need. And so we're looking at, is there ways we can use digital? Are there ways that we can also use other resources to get to those people that need that care? Because that's so important to all of the things we've been talking about, the whole health and wellness of our patients.
Thank you for that. I really appreciate it. Has anyone else got another comment at all about ensuring remote care has that human touch?
I can add to it, right? So at Kaiser, being an integrated system and being a nonprofit, we have the social reach and we deploy the resources very effectively all the time, and both, I agree with all of our participants here, is that COVID, the pandemic, did put a big bright light on it, right? So this inequality, where I've seen, a few more use cases, if I can add, is using data to actually help overcome that, right? So, I talked about online, offline models, but using offline models, using social determinants of health, ability to actually provide that assistance to the people who need assistance, actually, that who would have not gotten the intervention if we left it on their own, Maybe they needed a car ride back to the hospital, or maybe they needed a nurse visit to the home, or a wheelchair assistance. The idea of using data to help fight inequality is also equally powerful there.
Thank you. So we're coming. Oh, sorry. Go ahead, Kristen.
I would just say that. No, it's okay. The human touch, is about human and touch, and I don't think digital needs to take anything away from that. If there's empathy in the process, if we can use digital tools to make it more human centric for everybody involved, then we can do that. And in terms of touch, let's say, remote care can, like Pratt is saying, can sort of expand perhaps the people that we can touch with specialists, with certain approaches, with mental health challenges. There's ways to use digital to both enhance the human aspects and the touch aspects of care. And as long as we don't get too focused on the technology and we keep with the humans and the clinical needs that they have, I think digital can only enhance that.
Thank you for that, Don. So we're coming close to the end of the discussion, and there's one topic I'd really like to discuss with you all, and it's really looking at the adaptability of healthcare professionals. And so let's look at workforce planning here. And maybe we'll start with you, Pratt. So how prepared or skilled is the healthcare workforce for the digital future? I mean, how do you see their data, digital, and maybe even their genomic literacy skills panning out? It'd be really interesting to understand, because we kind of need them on board for this to work in years to come. So maybe, Pratt, you start us off, and everyone else can add as well some comments. Thank you.
Yeah, today digital in the healthcare, especially in the for the care teams, is much more around enabling their existing processes and extending their processes. As we bring in the newer digital technologies, there is significant opportunity to help them, assist them in a meaningful way. The cardiac rehab example I mentioned, we're going to be in this 365 days, 24/7 data creation mode. If I'm wearing a watch, I'm actually producing data all day long, right? Which of that data points really matter for my physicians? When does it matter? How do we organize it for them? How do we make sure that they are looking at much more holistic picture so that they can put focus in the right areas? AI, ML, and other technologies significantly can help actually make that easier for them. Today, the way it is that you get charts for everything. I get a chart for, my vitals. I get charts for labs. Everything is a chart. And the onus is on the provider to actually synthesize, and I have 20 minutes for a visit, and I'm listening, I'm learning, I'm inputting data, but I'm also diagnosing. There's only so much as a human you can go through. The ability to actually look at it in a nonlinear way, ability to actually organize it, a huge opportunity for making provider experience really, really easy and impactful. The second thing is, we talked about this care anywhere, anytime. Imagine a day where a nurse is coming to my house and providing the visit there at my place. What are the tools that we need to put in her hand or his hand to make sure that they can reach back into the specialist with click of a button? Ability for them to say, here is what we are seeing, what should be the diagnostics, right? So ability to bring a provider from a hospital into the home via telehealth also matters. So the tooling and technologies, ease of use has a long way to go for providers. Today, it is still in a very primitive state around documenting and providing electronic charts, not a lot of intelligence.
So, Mubasha, what are your views then on how skilled is the workforce in the future, for a digital future? I mean, has there been some resistance towards this? What's your opinion on this?
I certainly think there's a need to upskill the workforce, that's for sure. And I think, that's been highlighted in many, seminal reports like the Topol Review in 2019, where that was a big focus, on training staff to become enabled to use these type of technologies and to handle the data. And certainly in our own experience, now delivering millions of telemedicine consultations globally. Training has been massive, as a component of that. And so just putting a doctor at the end of a video isn't the optimal way of delivering digital healthcare. And so it does require specific training, development of specific skills. Everything from the way you consult and examine a patient remotely, but even the softer skills, how do you build rapport with a patient using a channel like this? All are things which the workforce would really benefit from training. So hugely supportive of that entering medical curricula and becoming part of workplace training as well.
Thank you. And Kristen, I mean, some of these jobs, some people might feel threatened, like with robotics in caring and nursing tasks, and AI diagnostics, for instance. So what's the future for the workforce, in your opinion?
Well, I agree with what has just been said. I mean, we have just experienced probably the most profound change in customer behaviors of our careers, and I think it's going to create the most profound opportunity for change management that to follow that we've seen. But I'm encouraged because I've seen our clinicians adapt literally overnight. If you think about, we went from 7% virtual visits, and that increased 2,000 to 3,000% in a matter of weeks. And they adapted. And obviously, and I agree wholeheartedly with what Pratt said, we've got to put our data scientists' arms around our clinicians and help bring some of the processing power to them to help coalesce all that data that we're asking them to now use in making important care decisions. That's a huge opportunity where we're going to marry that. But I also would remind us all the points we were making earlier, which is we cannot lose that human touch. That is so important. And that's so important to the relationship and what makes healthcare unique and makes our patients feel special. I think about what Mayo's doing down in Florida, where they're using robots as well as care providers in some of their COVID testing sites. And they're using the robots in a certain way. They're using them to move supplies and specimens back and forth and keeping the caregiver in front of the patient so that the patient then sees, okay, the robot's taking some of the stuff that's making me feel uncomfortable away, but the person, that human interaction remains. And that's so important as we look ahead.
And finally, Don, what is your thoughts on the workforce planning for a future that's digital then? And I think we'll end with that last question.
Sure. I'll reflect what a few have already said. I think we need software and data to work for the clinicians, not vice versa. And I'm certain it seems vice versa in the early days, trying to get the data into the system so bills can go out or what have you. And we need to really turn that equation around and have the software and the data and the decisions and such really help clinicians make better decisions and have a better experience taking care of their patients. But the other thing I would say is that, I think COVID has really taught us that healthcare has the best workforce in the world. I mean, things that we thought would take a year took a month. Things that we thought would take a couple months took a week. I mean, we really condensed everything. I mean, the opening up new hospitals in 2 weeks. I mean, some of the stats you said, Kristen, around virtual care. I mean, we really turned healthcare on its head to really fight this pandemic. And it really is because of the adaptability of the workforce. And it really is because of, in this case, we had a sense of urgency and a clear mission and those sorts of things. And the challenge for us as leaders is to keep establishing those clear missions and that sense of urgency and those sorts of things. Because when we have that and when we have tools that are really helping, then our workforce, I think, can adapt and can learn quickly. We've seen it in spades over the last year.
That is a very positive note to end on. Thank you very much, Don. I really do believe in adaptability, and I think that's going to happen. So thank you so much. You've been a great panel. I've learned a lot today, and thank you out there for listening to this webinar. Thank you very much.
Great. Thank you.
Thanks, Liz.
Thank you.